Dr. Jayaprakash Gill Anjuman, Dr. A.J. Kumar, my friend.
Our chief guest, Dr. Jayaprakash Narayan, sir, to address the gathering.
Mr. Chairman, friends, I'm truly delighted to be with all of you. The reason why I came here is that this is a public health dentistry convention. Einstein once said, 20th century is characterized by perfection of means and confusion of ends. We have mastered the methods, we have forgotten the goals. Most professions are not exempt from this malady. Unfortunately, medical profession too, oftentimes, is a victim of this disease. And therefore, it always pleases me when I see a group of clinicians deeply committed to true health care, not merely looking at patient as a cash cow, but actually using technology and skills to improve the quality of health. To me, that is the essence of our profession. And it's for this reason that I've decided to come here today, though today is personally a bad day for me because I'm going on a long, grueling campaign over the next 17 days. And at my request, the organizers have actually advanced this inaugural session from about 4:30 or 5, maybe 5:32 this time. I'm grateful to you for that. Normally, we see events being postponed but not advanced, and I deeply appreciate you for that. Friends, I'll make only 4 specific points. We live in a wonderful era. Oftentimes in our complaints, in our frustration that some of our ambitions are not fulfilled, we tend to forget what a wonderful era in which we live. Just as I left home to come here, a bright young American undergraduate student, she met me, Sahiti. I was asking her about the perception of her generation in the United States about the future. She told me that somehow most of the young people in colleges feel somewhat gloomy, and they're trying to postpone the day of reckoning by going for more degrees, post-graduation. In other words, education has become a way of disguised unemployment. Now, in one of the most successful civilizations in the history of mankind, there is this gloom. You go to any country, at any level, oftentimes we forget what a glorious world we live in, and we keep complaining. And I'm sure that's true with medical students, that's true with students of dentistry, that's true with engineers, that's true with 1,000 other professions. That's because somewhere we lost a sense of perspective. What this is all about, I ask of all of you, particularly the young students, never to forget one important thing, that this is the best of all possible worlds. Before this meeting commenced, the Dean, Dr. Jay Kumar, and I were having a brief conversation, and he was telling me that after seeing the shenanigans of many of these so-called religious and devout people, he became a skeptic. I too am an agnostic. I do not know if there is a God, but I do believe that there is sin. I believe there are 2 great sins. The first is unfulfilled potential. If an individual or a society has the innate capacity to rise to a certain height, but is not able to fulfill that potential for want of opportunities to the individual or for want of wise organization for the society, then that is a sin. The second great sin is avoidable suffering. Pain, disease, old age, death, and all kinds of sufferings we see. If there is a disease which is unavoidable, cannot be prevented, and we only have to endure or sometimes succumb. We may grieve, but it doesn't really serve any purpose beyond that. But barring a few such incurable diseases, and barring death, which is inevitable, and I personally believe is necessary, thank God there is death. If there is no death, it would have been disastrous for mankind. All of us would be living into our 90s and 100s and 200s and still be lording over you, never giving a chance to the next generation. Life will be unrelenting tedium. Barring these inevitable things, almost every single suffering on earth today is fully avoidable. From starvation to malnutrition to hunger to poverty to disease to deprivation. Never before did mankind have this privilege of being able to say that we have now the technology and the resources to fulfill human potential and to eliminate avoidable suffering. And you are in a wonderful profession that actually is in the business of eliminating avoidable suffering. There's nothing more glorious than that, nothing more beautiful than that. Rejoice in that. Do not lose sight of it. You'll certainly make money, you'll certainly make success of your lives. A lot of things will come into your life, but nothing matches the joy that you should feel at being able to eliminate avoidable suffering. Please keep track of that. A man called Ignaz Semmelweis. I do not know if many of you have heard the name. Anybody heard the name? Ignaz Semmelweis. None. Yes. Yes. He was born in 1818 as a Hungarian. He was a physician. He was actually an obstetrician involved in handling childbirth. Remember, those were the days when there was no understanding of bacteria or viruses, infection, antisepsis, asepsis, nothing. Semmelweis chanced upon the observation that if only the obstetricians washed their hands clean after examining each patient and before examining a new patient, somehow the puerperal infections, the streptococcal infections that most women during childbirth were prone to in those days, that incidence was reduced dramatically. It used to be up to 35–40% of all childbirths. And because there were no antibiotics, in a very substantial number of cases, these infections were fatal. The mere fact of childbirth meant a near fatality, a near fatal experience for a vast number of young women. This man understood somehow, empirically, not because of any scientific study of why it is caused, but he simply observed that by washing hands clean, you are able to prevent this infection and save lives. And he told the doctors, he made it a mission of his life to tell everybody, please wash your hands before you touch a patient, and wash your hands after you examine a patient. This simple thing. He was ridiculed. The doctors, the obstetricians felt humiliated. Who is this fellow who tries to wash our hands? My goodness, washing our hands? How dare he? Finally, this man died frustrated at the age of 47. He became insane. He was committed to an asylum. And some people actually believe that he was brutally assaulted in the asylum. And he died, by our standards today, at a relatively young age of 47. Now just imagine yourselves in 1850s and today in 2012. Aren't you glad that you don't live in an age when you tell the people that, look, here is an answer to a problem. This is what I observed empirically. You don't have to go through that humiliation and indignity. You have a willingness to accept something based on empirical evidence, and if it's something tried and tested, a quick adaptability across the world. Take a simple thing like smallpox. All of you, the students here, were born after smallpox was eradicated from the globe. But many of us, some sitting here, and I was one of those, who knew smallpox as young people, who heard of smallpox epidemic somewhere or the other. I remember in my own village, in one locality, they said there was a smallpox. We dared not even go there. It was unthinkable. The vaccine was known for quite some time. If you remember, Jenner, Edward Jenner is the man who actually first described the Jennerian vesicles. And then Louis Pasteur did come out with the vaccine. He understood the principle of the vaccine. Eventually, the vaccine was perfected. But still, it did not work. What happened in the 1960s and 70s to make this change possible? Because please remember, smallpox is the only disease in human history completely eradicated so far. We are now hoping that poliomyelitis will be the next one, but we still are not there. We used to have a vaccine for quite some time before that. When we were kids, I don't know if any of the senior people here recall, they used to have a cylindrical needle. They used to puncture and then twist. And then the muscle would tear, there'd be lots of bleeding, pain obviously, infection inevitably. Oftentimes the vaccine did not take effect because of these infections. In most cases, we all ran for our dear lives whenever the vaccinator came to our village, because there's so much of pain and suffering attached to vaccination. Subsequently, they discovered that there's a better method. They had a needle, they gave us several pokes. Instead of twisting and tearing, they simply gave several pokes. And even today, I'm sure as dental surgeons and students, you all realize how uncomfortable most patients are to come to you. That the fear of the scalpel or the needle, even when you want to give the local anesthesia, is so great in the minds of many people, they would like to avoid a doctor like the plague. And when there were so many pokes given, it was that much more painful, in the mind at least. Therefore, there was avoidance. And somebody came up with a simple solution. I was actually trying to see who it was. I could not locate who it was. I think a little bit of research will tell us who it is. It's an unknown person. Came up with an idea of a biforked needle, a needle with two forks. If you remember, after this, I have gone through all three phases of vaccination. Some of you, I'm sure, Dr. Wali and others would have gone through all the three phases. So this guy came up with this biforked needle. You put the drop of vaccine and then have one parallel stroke, a single stroke. What you require is a subcutaneous administration of this vaccine, and then the body's immunity system will take over. Within 5 years, smallpox was eradicated. It was this simple innovation, this simple technological innovation that made a spectacular miracle, greater than what all physicians on earth so far have accomplished together with all our work. It made that possible. We live in the best of all possible worlds. Even in your most trying moments, never forget that, and always rejoice in that. 100 years ago, it was unthinkable that we would actually have enough food. Today, India has more food grains in storage silos or in open, because we don't have enough of storage capacity, than the total production of food in 1947. We produced 56 million tons in 47. We have about 72 million tons of food grains in our government storehouses. I'm not talking of private storage today in the country. Government warehouses, 72 million tons of food grains. All because one exceptional human being who passed away a few years ago, he took it into his head that we should not allow a person to die. We'll produce enough. Norman Borlaug alone and his colleagues together are credited to having saved 2 billion lives. 2 billion lives were saved in the past 50 or 60 years that would otherwise been lost because of starvation. We can go on and on citing any number of exceptional examples that made spectacular difference to our lives. You live in the best of all possible worlds. Never lose sight of it. And you are in this profession dealing with avoidable suffering, and rejoice in it. Do not let the humdrum, mundane, daily, ritualistic items of work, or the quest to make more and more money, the quest to get more and more honors and awards and rewards, do not let it affect the essence of what we're trying to do here. The second point I'd like to make is about healthcare in general. I'm not an expert in dental care, except that I try not to go to a dentist, like many people. But in this country, while we increasingly become more and more sophisticated about medical care, I think we have very rudimentary understanding of health care, and I'm sure dental health is not radically different. Just take the numbers. Our healthcare expenditure in this country is about 5.3 to 5.4% of the GDP. The numbers could vary depending on the calculation. Nobody knows the exact number because much of it is unaccounted, but over 5% is a reasonable approximation. The public health expenditure, and this is about 1% GDP. In 2004, the current government in Delhi promised that it will go up to 2 to 3% GDP, and I was one of those who took it upon myself to utilize that opportunity to improve the quality of healthcare in the country, and therefore I authored this National Health Mission document, from which came the National Rural Health Mission now being implemented in the country. My mission was actually much bigger, the National Health Mission. It was a truncated mission. Also, it was not really fulfilling the vision that we started with. I really wanted to recreate the National Health Service in Britain. A universal, accessible, quality healthcare across the country with public and private partnership and with a tiered quality care system. We are nowhere near that. If you take the public health expenditure as a share of total health expenditure of India, it is under 20%. It was 17% then. It probably is close to 19 or 20%, maybe 21% max today. One of the latest reports indicates it's 21%, but we have to verify. But it's not that far different from 17%. I do not know how many students here are aware. We are in the disgraceful company of 3 other countries in the world. The ABC of the world: Afghanistan, Burma, and Cambodia. A generation ago, about tennis, we used to call the ABC of tennis: Amritraj, Borg, and Connors. Borg and Connors actually fulfilled their potential. Amritraj did not manage to. But we certainly have the ABC of the healthcare today, and India is in that very sad company. Not even the rest of South Asia, not even sub-Saharan Africa is as bad as India in terms of public health expenditure, the share of total health expenditure of the country. And even that money is oftentimes badly deployed. It goes more for tertiary care than for primary care. Even when deployed for primary care, it's done badly, inefficiently, and of course there's a lot of corruption all around. That's a ubiquitous thing in our country. The consequences are horrendous. Behind these cold numbers are harsh realities. For a single episode of hospitalization in this country, if you're to be admitted in a hospital as an inpatient, for a single episode, whether it's in a government hospital or a private hospital, on an average, an Indian spends 58% of the annual income. %40 of the people who are hospitalized, they either borrow at usurious rates. In one case, I found a woman who borrowed 11,000 rupees for a cesarean, which was actually necessary because it was a breech presentation. She was paying 15% interest per month. 15% per month on 11,000. She was paying 1,650 rupees a month by way of an interest on 11,000 rupees borrowed. And for her, a village agricultural worker, a daily wage laborer, it was an astronomical sum. In 25 to 30% cases, people who were above poverty line earlier actually descend into poverty on account of healthcare costs. There is devastation in this country on account of poor healthcare, not because we cannot afford it. That's the point I'm making. We can afford it. It's well within our capacity as a country. Without dramatically enhancing the budgets, if we do the right things in the right way, the government does its job well, we can make a radical difference to millions of lives in this country in the field of healthcare. In 1948, in Britain, the National Health Service was established in the wake of the Second World War, in the aftermath of the Second World War, at a time when there was starvation in the country, food shortages and rationing, and they had neither technology nor resources comparable to what we have today. And yet the vision and the integrity and the commitment of a few outstanding leaders made National Health Service possible in Britain at the time. Anurin Bewan, who was the health minister, who was one of those who labored for this, he used to come home every night at 10 o'clock, wearily after 14, 16 hours of work, designing the model, persuading all the stakeholders, persuading his colleagues in the political parties in Parliament, talking to the unions of health workers and making them come on board and so on and so forth. And wearily he used to walk up his steps every day after a quick bite of dinner with one suitcase a briefcase of files still to be seen that night. One day he came home not with one but two briefcases of books and papers. And after eating, he was climbing up the steps, and his long-suffering wife, she said, "Anurin, it's bad enough that you take one to bed every night, but it's positively immoral to take two to bed." But it is with such blood and sweat and tears and toil and pain and suffering and anguish that exceptional institutions are built to make healthcare accessible to the millions of people. If we do not do it in this country now, it's a matter of disgrace. I don't view dental health care as different from the traditional medical health care. Both are the same. Really, they're all together. We cannot isolate them. For the patient, your fancy degrees and your super specialties don't matter. For the patient, he has the pain, he has the suffering, he needs relief, period. Now, what fancy degree you have, what kind of college you go to is your problem. For the individual seeking to prevent a preventable disease or a treatment or a cure from a malady, what matters is whether you are able to give that relief at the least cost in the most efficacious manner or not. Oftentimes we're forgetting that. Again, 20th century being characterized by perfection of means and confusion of ends. Please recognize what we're capable of doing as a country. Even as we practice and practice well and succeed, focus on health care. This country deserves something far, far better. Almost every significant country in the world has a much better health care system. Ours is unarguably the worst among major countries and one of the worst in the world. We deserve better for ourselves as human beings. A third point, in this country we are all people deeply imbued in tradition and therefore our family, the caste or the community or a religious group, perhaps even a professional group. Your own dental council or medical council or engineers, some other institution of engineers or something else, because of common economic or social interest. There is a bond and trust. But across these barriers, this trust is failing in this country. There's tremendous mistrust. We need to foster this trust. So much so that the professional regulatory bodies are not trusted by the rest of the community. The general belief is the medical council is there to protect the doctors, not to protect the community. I was delighted to hear today that Dr. Wally and his colleagues made the dental council significantly different from the medical council, for instance, actually improving the standards and ensuring an honest and clean regime for medical education, dental education, and creating a body that's trustworthy. I wish I could say that that's true with all the professional self-regulatory bodies. We need to engender this trust between professions, between groups in societies. We cannot have doctors mistrusting civil servants hating politicians, politicians hating judges, judges hating everybody. That's not a very sane society. We are required to build a society based on trust, specialization, or doing something in a narrow area is the logic of modernity. But it does not mean that we're all at war with each other. We're all doing the same thing. We're serving the same purpose. Finally, if today, on the 25th of May 2012, sitting in the vicinity of Hyderabad city, if I do not say a word about corruption, I would be failing in my duty, because today in Hyderabad city I see hundreds of cops all around, many roads blocked in anticipation of the arrest of some corrupt thugs. It's not important which of the fellows made money, who are the corrupt ones. But it's important to recognize that we are wrecking our lives and our society by creating a kleptocratic culture where public office is for private gain. On the one hand, we have people like Warren Buffett, who made billions upon billions and who gave away every single cent and dime, leaving a small amount for himself, not even giving to his children. Warren Buffett did not even give to his children any money. His father, who invested in his son's company 50 years ago, he gave his share to his grandchildren. So Buffett's children got a small share, approximating $1 million or $2 million, in a $50+ billion empire. Warren Buffett gave everything to society, without even seeking his personal name. The world's largest benefaction ended without even recognizing the individual. There's not even a Buffett Foundation. It all went to Bill Gates, Bill and Melinda Gates Foundation. With what desire? To eliminate all avoidable suffering from the globe itself, and to help fulfill human potential in the globe itself. What a magnificent, what a spectacular dream. What a worthy life. It is such lives, such work we should celebrate, not the ignoble rascals who make commerce a public office. In this country, somewhere, we have lost all sense of perspective, despite all our talk about Bhagavad Gita and God everywhere and a statue in every corner, in particular on the streets and on the national highways blocking the traffic. We've forgotten what it is to really care about the community and society at large. This corruption is a manifestation of that. Beyond caste and region and religion, if we do not take it on ourselves, the task of rebuilding this country, punishing the corrupt and creating an institutional framework in which corruption will not be the norm, it will be the exception, and it will be dealt with severely and swiftly, no matter who is guilty. Unless we create that, we'll be doing a great disservice to ourselves. And Indian people are not specially corrupt. So if some of us are told that, look, in our genetic makeup there is corruption, it's rubbish. We are no more or no less corrupt than the rest of the humanity. In fact, there is evidence to show that Indians in general are less corrupt than the rest of humanity. Several experiments were conducted globally in which they gave either a small amount of money in an envelope or a mobile telephone or whatever, and they tried to see how many people who found these envelopes or these mobile phones tried to give it back to the owner, try to trace the owner and give it back. In case of envelopes, they actually put a small little address. 85% of Indians tried to give it back to the owners. They made a conscious effort to give back to the owners. We are not inferior to anybody else morally. It's our institutions that are weak. I'm not opposing morality and values. Of course we need morality and values. What I'm arguing is that we have morality and values in this country. What we do not have are institutions to protect and nurture that morality and values. Morality and values are like the water in the glass. Of course, water is absolutely required. It's life-giving. Who can say that, particularly in this hot and harsh summer? This the hot and harsh summer. But if you don't have the container, the water will spill over, it will evaporate. It's there somewhere, but you cannot use it. You cannot drink it to quench your thirst. In order for the water to have use, you require the container to protect and nurture that water. The institutions of state are those that protect and nurture the values in society. If you create a framework in which the honest people are rewarded and respected, and the corrupt ones are punished and penalized, you will surely get a system in which most of the people behave in a socially productive manner. If the contrary is true, if the most corrupt fellows are the ones who reach the top, if the most honest ones are the ones who suffer most, you are sending aloud a very strong and dangerous message to society. Do the right thing, you'll suffer. Do the wrong thing, you'll flourish. What I ask of you is to remember this and to believe this and to fight for that institutional framework that will protect and nurture integrity in public life and in private life. What we need in this country are tall men and women, as J.J. Holland said. Tall men and women, sun-crowned, who live above the fog in public duty and in private thinking. Not the scum of humanity, who ought to be locked away behind bars, who masquerade as leaders in this country and become kleptocrats. Stand up for your future. Do not limit yourselves to dental care alone. You're human beings first, citizens of this country next. And incidentally, one is doing this job, another is doing another one. That depends on your own heart's stirrings, your own aptitude and opportunity. But ultimately, we're all trying to achieve the same things. So never lose sight of the common weal, even you excel in your profession and your chosen sector. I take great pleasure in participating in this national convention. I wish you all the very best. Good luck, and thank you.
Thank you, sir.